Dear students, in Lifestyle Diseases and Prevention subject, today we will learn a new topic, stroke. In this topic, we are going to discuss what is meant by stroke, when it will happen, what is the basic pathogenesis behind in the stroke, what are all the symptoms of stroke, the diagnostic procedure, treatment options, and the preventive measures in detail. Okay, so we will discuss in this flow. Let's start with the introduction part. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissues from getting oxygen and nutrients. The brain cells begin to die in a minute. A stroke is a medical emergency and to prompt treatment is crucial. Early action can reduce brain damage and other complicated sequence issues. The good news is that fewer Americans die of stroke now than in the past. Effective treatment can also help to prevent disability from the stroke. What are all the major symptoms of stroke? If you or someone you are with may be having a stroke, pay particular attention to the time the symptom behind. Some treatment options are most effective when given soon after a stroke begins. Signs and symptoms of stroke include: number 1, trouble in speaking and understanding what are others saying. You may experience confusion, slur your words, or have difficulty understanding speech. Paralysis or numbness of the face, arm, or leg. You may develop sudden numbness, weakness, or paralysis in the face, arm, or leg. This often affects just one side of your body. Try to raise both your arms over your head at the same time. If one arm begins to fall, you may be having a stroke. Also, one side of your mouth may droop when you try to smile. Problems seeing in one or both eyes. You may suddenly have blurred or blackened vision in one or both eyes, or you may see double. Headache. A sudden severe headache which may be accompanied by vomiting, dizziness, or altered consciousness may indicate that you're having stroke. Trouble walking. You may stumble or lose your balance. You may also have sudden dizziness or a loss of coordination. When we have to approach a doctor for stroke, seek immediate medical attention if you notice any signs or symptoms of a stroke, even if they seem to come and go or they disappear completely. Think fast and do the following. Face. Ask the person to smile. Does one side of the face droop? You have to notice it. Arms. Ask the person to raise both arms. Does one arm lift downward? Notice it. Speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? Don't wait to see if symptoms stop. Every minute counts. The longer a stroke goes untreated, the greater the potential for brain damage and the permanent disabilities. What are all the major causes associated with stroke? There are two main causes of stroke: a blocked artery, that is ischemic stroke, or leaking or bursting of a blood vessel, hemorrhagic stroke. Some people may have only a temporary disruption of blood flow to the brain, known as a transient ischemic attack, TIA, that doesn't cause lasting symptoms. Ischemic stroke. This is the most common type of stroke. It happens when the brain's blood vessels become narrowed or blocked, causing severely reduced blood flow, that is called ischemia. Blocked or narrowed blood vessels are caused by fatty deposition that build up in the blood vessels or by blood clots or other debris that travel through your bloodstream and lodge in the blood vessel in your brain. Some initial researchers shows that COVID-19 infection may be a possible cause of ischemic stroke, but more study is needed. Hemorrhagic stroke. Hemorrhagic stroke occurs when a blood vessel in your brain leaks or ruptures. Brain hemorrhages can result from many conditions that affect your blood vessels. Factors related to hemorrhagic stroke include uncontrolled high blood pressure, over-treatment with blood thinners, that is anticoagulants, bulges at weak spots in your blood vessel walls, that is called aneurysms, trauma such as a car accident, protein deposits in the blood vessel walls that lead to weakness in the vessel wall, that is called cerebral amyloid angiopathy, ischemic stroke leading to hemorrhage. A less common cause of bleeding in the brain is the rupture of an abnormal tangle of thin-walled blood vessels called arteriovenous malformation. Transient ischemic attack. A transient ischemic attack, sometimes known as mini stroke, is a temporary period of symptoms similar to those you would have in a stroke. A transient ischemic attack doesn't cause permanent damage. They are caused by temporary decrease in blood supply to part of the brain, which may last as little as 5 minutes. Like an ischemic stroke, a transient ischemic attack occurs when a clot or debris reduces or blocks blood flow to part of your nervous system. Seek emergency care even if you think you would have a TIA because your symptoms got better. It's not possible to tell if you're having a stroke or TIA based only on your symptoms. If you have had a TIA, it means you may have a partially blocked or narrowed artery leading to your brain. Having a TIA increases your risk of having a full-blown stroke later. Now we will discuss the major risk factors for the stroke progression in the human body. Many factors can increase the risk of stroke. Potentially treatable stroke risk factors include lifestyle risk factors, medical risk factors. So the lifestyle risk factors includes being overweight or obese, lack of physical activity, heavy or binge drinking, use of illegal drugs such as cocaine and methamphetamine. So other medical risk factors includes high blood pressure, cigarette smoking, high cholesterol, diabetes mellitus, obstructive sleep apnea, cardiovascular disease including heart failure, heart defect, heart infection or abnormal heart rhythm such as atrial fibrillation, personal or family history of stroke, heart attack or transient ischemic attack, even in recent times COVID-19 infection. Other factors that are associated with a high risk of stroke includes age. People age 55 or older have a higher risk of stroke than do younger people. African Americans have a higher risk of stroke than do people of other races. Sex. Men have a higher risk of stroke than women. Women are usually older when they have strokes and they are more likely to die of strokes than or men. Hormones. Use of birth control pills, or hormone therapies that include estrogen increases the risk of stroke. Now we will discuss the complications of stroke. A stroke can sometimes cause temporary or permanent disabilities depending on how long the brain lacks blood flow and which part was affected. Complications may include paralysis or loss of muscle movement. You may become paralyzed on one side of your body or lose control of certain muscles such as those on one side of your face or one arm. Difficulty talking or swallowing. A stroke might affect control of the muscles in your mouth and throat, making it difficult for you to talk clearly, swallow, or eat. You also may have difficulty with language, including speaking or understanding speech, reading, or writing. Memory loss or thinking difficulties. Many people who have had strokes experience some memory loss. Others may have difficulty thinking, reasoning, making judgments, and understanding concepts. Emotional problems. People who have had strokes may have more difficulty in controlling their emotions, or they may develop depression. Pain, numbness, or other unusual sensations may occur in the parts of the body affected by stroke. For example, if a stroke causes you to lose feeling in your left arm, you may develop an uncomfortable tingling sensation in that arm. Changes in behavior and self-care ability. People who have had strokes may become more withdrawn. They may need help with grooming and daily chores. What are the preventive measures available for stroke management? Knowing your stroke risk factors, following your doctor's recommendation, and adopting a healthy lifestyle are the best steps that can be taken to prevent a stroke. If you have had a stroke or a transient ischemic attack, these measures might help prevent another stroke. The follow-up care you receive in the hospital and afterward may also play a crucial role in the management practice. Many stroke prevention strategies are the same as strategies to prevent heart disease. In general, healthy lifestyle recommendations include controlling high blood pressure, that is hypertension. This is one of the most important things you can do to reduce your stroke risk. If you have had a stroke, lowering your blood pressure can help prevent a subsequent transient ischemic attack or stroke. Healthy lifestyle changes and medications are often used to treat high blood pressure. Lowering the amount of cholesterol and saturated fat in your diet. Eating less cholesterol and fat, especially saturated fat and trans fats, may reduce the buildup in your arteries. If you can't control your cholesterol through dietary changes alone, your doctor may prescribe a cholesterol lowering medication. Quitting tobacco use. Smoking raises the risk of stroke for smokers and non-smokers exposed to second-hand smoke. Quitting tobacco use reduces the risk of stroke. Managing diabetes. Diet, exercise, and losing weight can help you keep your blood sugar in a healthy range. If lifestyle factors don't seem to be enough to control your diabetes, your doctor may prescribe diabetic medication. Maintaining a healthy weight. Being overweight contributes to other stroke risk factors such as high blood pressure, cardiovascular disease, and diabetes. Eating a diet rich in fruits and vegetables. A diet containing 5 or more daily servings of fruits or vegetables may reduce your risk of stroke. The Mediterranean diet, which emphasizes olive oil, fruit, nuts, vegetables, and whole grains, may be helpful. Exercise regularly. Aerobic exercise reduces your risk of stroke in many ways. Exercise can lower your blood pressure, increase your levels of good cholesterol, and improve the overall health of your blood vessels and heart. It also helps you lose weight, control diabetes, and reduce stress. Gradually work up to at least 10 minutes of moderate physical activity such as walking, jogging, swimming, or even bicycling on most, if not all, days of the week. Drinking alcohol in moderation, if at all. Heavy alcohol consumption increases the risk of high blood pressure, ischemic strokes, and hemorrhagic strokes. Alcohol may also be interact with other drugs you are taking. However, drinking small to moderate amounts of alcohol, such as 1 drink a day, may help prevent ischemic stroke and decreases the blood clotting tendency. Talk to the doctor about what's appropriate to this. Treating obstructive sleep apnea, that is called OSA. The doctor may recommend a sleep study if you have symptoms of OSA, a sleep disorder that causes you to stop breathing for short periods repeatedly during sleep. Treatment for OSA includes a device that delivers positive airway pressure through a mask to keep your airway open while you sleep. Avoiding illegal drugs. Certain street drugs such as cocaine and methamphetamine are established risk factors for transient ischemic attack or a stroke. Preventive medications. What are all the general medical preventive measures are available for the management of stroke? Antiplatelet drugs. Platelets are cells in the blood that form clots. Antiplatelet drugs makes these cells less sticky and less likely to clot. The most commonly used antiplatelet medication is aspirin. Your doctor can help you determine the right dose of aspirin for you. The doctor might also consider prescribing Agrinox, a combination of low-dose aspirin and the antiplatelet drug dipyridamole to reduce the risk of blood clotting. After a transischemic attack or a minor stroke, the doctor may give you aspirin and an antiplatelet drug such as clopidogrel, that is familiarly known as Plavix, for a period of time to reduce the risk of another stroke. Anticoagulants. These drugs reduce blood clotting. Heparin is fast-acting and may be used short-term in the hospital. Slow-acting warfarin may also be used over a longer term. Warfarin is a powerful blood-thinning drug, so you will need to take it exactly as directed and watch for the side effects. You will also need to have regular blood tests to monitor warfarin's effects. Several newer blood-thinning medications are available for preventing strokes in people who have a high risk. These medications include dapigratan, abixaban, edoxaban, etc. They are shorter acting than warfarin and usually don't require regular blood tests or monitoring by the doctor. These drugs are also associated with a lower risk of bleeding complications. Diagnosis. Things will move quickly once you get to the hospital as your emergency team tries to determine what type of strokes you are having. That means you will have a CT scan or other imaging test soon after arrival. Doctor also need to rule out other possible causes of your symptoms such as brain tumor or a drug reaction. Most of the doctors will prescribe to go for the brain imaging studies. A physical exam. Initially, the doctor will do a number of tests you're familiar with, such as listening to your heart and checking your heart pressure. You will have a neurological exam to see how a potential stroke is affecting your nervous system. Blood testers. You may have several blood testers, including testers to check how fast your blood clots, whether your blood sugar is too high or low, and whether you have an infection. CT scan. A CT scan uses a series of X-rays to create detailed image of your brain. A CT scan can show bleeding in the brain, an ischemic stroke, a tumor, or other conditions. MRI scan. An MRI uses powerful radio waves and magnets to create a detailed view of your brain. An MRI can detect brain tissue damaged by an ischemic stroke and brain hemorrhages. Carotid ultrasound. In this test, sound waves create detailed images of the inside of the carotid artery. It shows the buildup of fatty deposits and blood flow in the carotid arteries. Cerebral angiogram. In this uncommonly used test, the doctor inserts a thin, flexible catheter through a small incision, usually in your groin, and guides it through your major arteries and into your carotid or vertebral artery. Then your doctor injects dye into your brain vessels to make them visible under X-ray imaging. This procedure gives a detailed view of arteries in your brain and neck. Echocardiogram. Echocardiogram uses sound waves to create detailed images of the heart. An echocardiogram can find a source of clots in the heart that may have traveled from your heart to the brain and caused the stroke. Treatment procedures. To treat an ischemic stroke, the doctor may quickly restore blood flow to your brain. This may be done with the IV medication. Therapy with the drugs that can break up a clot has to be given within 4.5 hours from when symptoms first started, if given intravenously. The sooner the drugs are given, the better. Quick treatment not only improves your chances of survival but also may reduce complications. An IV injection of recombinant tissue plasminogen activator (TPA) is a gold standard treatment for ischemic stroke. An injection of TPA is usually given through a vein in the arm with the first 3 hours. Sometimes TPA can be given up to 4.5 hours after stroke symptoms started. This drug restores blood flow by dissolving the blood clot causing your stroke. By quickly removing the cause of the stroke, it may help people recover more fully from the stroke. The doctor will consider certain risks such as potential bleeding to the brain to determine if TPA is appropriate for you. Other than this, there are a lot of other procedures which are focusing on the removal of blood clot or the dissolving of blood clot using medications. Every person's stroke recovery is different. Depending on the condition, the treatment team may include different personalities to handle neurologically, biochemically, and immunologically. That's all about the information for stroke. So students, please prepare what is meant by stroke, what are all the symptoms of stroke, what are the first aid and preventive measures to be essentially taken to stroke, diagnostic procedures available to confirm stroke, and the treatment processes available in the modern days for stroke. Already I have shared the material. Please go for this, and if you have any clarification, contact me. We'll discuss a new topic in the next class. Thank you so much for the attention.